Good evening, family and friends. My name is Melithon Polaris with United States University, FMP 597. This is week 4 cardiovascular note. I had the opportunity to see patient AR. I'm currently working out of a pediatric office. AR is a 10-year-old Hispanic male and who was accompanied by his mother. Mother provided the chief complaint saying, "My son says that his heart feels like it's racing every time he plays soccer." HPI, AR is a 10-year-old Hispanic male. He came into the office today with his mother with a complaint of intermittent episodes of rapid heartbeat during physical activity. This rapid heartbeat has been occurring just over 3 weeks. His mother reports that it usually happens when he's playing soccer or when he's running during recess or any other physical activity. The episodes are lasting 3 to 5 minutes, but resolve spontaneously as soon as he rests. Mother did notice that at the last practice that he appeared pale and he had some slight shortness of breath, which heightened her concern and caused her to bring him in this morning. The patient denies syncope, chest pain, dizziness, or cyanosis. He does report that he feels a bit tired after one of these episodes, but there's no prior cardiovascular diagnosis, no recent illness, no fever, or no use of stimulants such as coffee. Mother reports otherwise. AR is a pretty healthy young boy, and he's participating in everything at school as well as home as he helps out with his chores and keeping his room up. Currently not taking any medications, not even over the counter. Regarding allergies, there's no known allergies. Personal medical history, no medical history at this time. Regarding preventative care, his immunizations are up to date per the CDC pediatric schedule, and his last well child visit was 8 months ago. He has no surgical history, as well as he's never been hospitalized. Regarding family history, AR's father, he's 38 years old. He does have a diagnosis of hypertension, and he was diagnosed 2 years ago when he was 36. His mother is 36 years old. She's healthy with no current disease or condition being managed. His maternal grandfather does have a history of atrial fibrillation and was diagnosed in his 60s. Other than that, there's no familial history of congenital heart defects or sudden cardiac death. AR lives with his mother and her father, as well as his younger sibling. He's a 5th grader. He does well academically and is socially involved in sports. He does play club soccer, where he has practice or a game 3 to 4 times a week. Practice or game usually vary between an hour and a half to 2 hours. He doesn't have any exposure to tobacco at school nor at home, and his diet usually consists of home-cooked meals with the occasional fast food meal on the weekends. Review of systems, cardiovascular-wise, he reports episodes of palpitations during exertion, denies chest pain, syncope, or edema. Respiratory reports mild shortness of breath during episodes, but currently denies chronic cough or wheezing. Denies dizziness, headaches, or loss of consciousness. Denies weight loss or excessive sweating. Denies muscle pain or joint pain, as well as denies fever, fatigue, or recent illness. His weight is 74 pounds, height of 4'7", with a BMI of 17.2, which is normal for his weight and gender. Temperature was 98.6, slightly tachycardia with a heart rate of 102 beats per minute, blood pressure 104/66, respirations 20, and O2 sats were 99 on room air. Upon physical exam, generally, he was alert and oriented, cooperative pediatric patient. He's well developed and well nourished with no acute distress noted. Cardiovascular, he had a regular sinus rhythm with intermittent tachycardia, S1 and S2 present, no murmurs, rubs, or gallops noted. Peripheral pulses +2 with no edema or cyanosis observed. Respiratory, His lungs were clear upon auscultation bilaterally, no wheezing or rales or bronchi. HENT, normal cephalic. Tympanic membranes were intact. No carotid bruits. He was alert and oriented for age, and his cranial nerves grossly intact. Regarding his GI, his abdomen was soft, non-tender, non-distended with normal active bowel sounds. 3 differential diagnoses to consider is supraventricular tachycardia, palpitations, and congenital coronary artery anomaly. Supraventricular tachycardia, or SVT, as will be noted moving forward, it's the most common symptomatic arrhythmia seen in pediatric patients. And so a lot of the patients present with sudden episodes of rapid heartbeat, palpitations, and some mild shortness of breath. And these episodes usually occur during physical activity. One of the main things that aligns with AR is his mother saying that he has a racing heart rate during soccer practice, and the fact that these episodes are lasting 3 to 5 minutes and resolve with rest strongly support the SVT as the leading diagnosis. In addition to that, him presenting today with normal cardiovascular examination also supports this diagnosis, as he had a normal S1 and S2 in the clinic. He does deny syncope or chest pain, which may occur in more severe structural cardiac abnormalities. The other diagnosis that we have to consider is palpitations, because AR symptoms do occur with physical activity. The episodic and sudden onset nature of the rapid heart rate raises concern for underlying arrhythmia rather than normal physiologic response. So we need further diagnostic tests and evaluation to differentiate between palpitation and other arrhythmic causes. Now, congenital coronary artery anomaly must be considered, though it's very rare. But because this patient experienced symptoms during sports activities, structural cardiac abnormalities must be ruled out. The plan for him is the 12-lead EKG that was done in the office, and there was no sinus rhythm at the time. Going to order a Holter monitor for 24 to 48 hours just to capture if there's any intermittent arrhythmias. I ordered an echocardiogram referral to evaluate the cardiac structure, CBC, CMP, and a thyroid to rule out metabolic contributors. Right at this time, there was no treatment, as we need to wait for the findings of the diagnostic tests. He was educated on monitoring symptoms during physical activity, avoiding excessive caffeine, and recognizing warning signs such as chest pain, fainting, or tachycardia. We're going to see him again in a week for the Holter monitor results, and he's referred to a pediatric cardiology consult. We'll review the electrocardiograms exams when they're completed, and until then, he'll be placed on hold regarding sports participation until the cardiology evaluation is conducted. Thank you for your time. Have a great day.